talk briefly about the program you did in conjunction with CHIP, why we did it, how we did it, and how it facilitated the kids while the parents were at CHIP. And then I'll let you have the last question here.
Yeah, just real quick, we for our first CHIP program, it was our largest program, and one of the sort of feedback items that we got from a lot of people as we were promoting it was, I would really love to come to your program, but what am I going to do with my kids while I'm in the program, because you're there for 2 hours. It's a 2-hour lecture. I haven't found a 6-year-old yet who wants to sit through a 2-hour lecture about fiber. So, what am I going to do with my kids? So we talked about just offering sort of a child care situation where the kids would just go up in the kids' room and play, but we decided instead to do sort of a kind of a kids version of CHIP. If you're interested in the details, I can absolutely, I found a great program that we used. That was sort of a healthy eating class and a cooking class that we did in our fabulous kitchen here, because we have such a lovely facility. And it was great. So the way we formatted it was every week or every lecture, when the adults would go to their lecture, the kids would come. We would talk a little bit about a topic, fiber and cereal, and we'd do some activities. And then we'd go to the kitchen and we'd talk about a specific country and then food from that country, and then the kids would cook a meal with sort of traditional foods from that country, incorporating all of the things that we talked about in our little discussion. So we actually got some kids to eat artichokes, which we were pretty excited about. So it was a really fun time, and I really felt like we got some great results out of it. And we had some parents saying, "What are you guys cooking tonight?" And I'm like, "Oh, we're doing this great thing with lentils and artichokes and green beans." And they're like, "My kid's not going to eat that." I'm like, "Yeah, he is." And of course, if the kids are invested and they're involved in the actual cooking process, it's amazing what they're going to eat. And we had some parents come up to us after the program was over a couple months later, and they said, "My kids are still using the stuff that you taught them in that class. We were in the grocery store the other day, and I was going to buy a cereal, and my 8-year-old said, 'Wait, Mom, we have to look and see how much fiber is in that cereal.'" And so the 8-year-old was actually helping their parents, sort of keeping their parents on task for some of the things that their parents learned in their nutrition class, but also, it gave the parents an opportunity to talk to their kids about healthy eating. So I really felt like it really matched up well with that. And so if that's something you're interested in, I have my resources that I used, and I'd be happy to share that with you.
Something to say about this?
So something along the same lines, and first I'll start with your question earlier on. There are two things. If you want to get people to come to your expos, maybe you need to look at it more as, let me go to them, or let us go to them. So the two things that we have used: one, having someone, that floater I was talking about at any health event, someone who's going out and talking to people, who's just interacting with everyone else who is there, and saying, "Oh, so this is what we do, and what do you guys do?" We've had a lot of our invitations because of other people who are at the health expo saying, "Oh, please come to our church, please come to our organization," and doing this. So you really, just tapping into the community is really important. The second thing is using children, because really, parents don't know what to do with their children if they go to certain places, so keeping them occupied, yes, is very important. But another thing is just, having them do something that's completely engaging and fun, like Jenny was talking about. We have a children's health expo as well that we have started conducting. And so, they'll come and do the same things. New Start, for nutrition, they'll have a food pyramid, and they have exercises that they do, hula hoop, running around, using bouncing balls, but it's engaging for them. But then the adults can also go through their own stations, knowing that the kids are also doing something else that is geared towards health. So really important to involve children.
I just had one more quick question about the CHIP. You mentioned that hospitals and cardiology departments are sending their patients right to the program. What about insurance companies now? Are there any connections with insurance companies with all the new discounts on healthy lifestyles for your insurance?
That's a good question. We have not experienced that. We haven't had people's insurance cover their participation here. We haven't had insurance companies involved here. I have gone to one insurance company and said, hey, you know, we could do this program, and it was like, well, that's nice. So I don't know, but last year. Yeah, things are changing. Things are changing fast. And the focus is on wellness and prevention, and so this is another opportunity for us. So I have not tried out those things.
I don't have an answer, but what you just did, you threw there an amazing idea, and I'm just thinking out loud. What if then, as our health ministry director coordinator of the conference, approaches the president of Ohio Conference and let him talk with the insurance company of all the pastors, because we are insured under the same company, and him encouraging all the pastors to participate, let's say, in a CHIP program. And this way, you'll have one task solved as members of the church. You'll have already on board your pastor.
Because what I'm finding in insurance companies is, even if you don't meet their numbers for health and discount, as long as you're in a program working towards it, you can still get the discount.
So which companies do you have in mind? Do you have any?
I mean, I'm not sure if all the companies, but
Yes.
I mean, I just know Blue Cross Blue Shield.
Oh, really? The Blue Cross Blue Shield does that? Good. Oh, this is the insurance company of the pastors. Okay.
You have a plan set up of what you're going to do to improve, and you stick to the plan and you see the results.
Yes.
The discount.
Okay. Okay.
There certainly is more and more a push to that with the changes in healthcare, as you all know, that are coming very
That's
quickly.
a good idea. Thank you. Thank you very much.
Yes, sir.
I'll go back a little bit to the question that came from Delaware, how to get people to come to attend your programs. I think once you have the exercise done for your church members and they like the idea, they are the people to go out and invite. And you know, their faces will be glowing because they know what they're talking about, other than just giving handouts to church members who don't even know what they're talking about. And number two is to invest in your community if you want the community to be part of your program. The pastor of All Nations Church, Pastor Kwesi, and I have taken time for the last 3 years to really invest in the community around here, attending pastors' meetings. We have an association called Northland Alliance, which is a meeting for all pastors in the Northland area, and attending even their programs, Easter program, Thanksgiving program, so that when we have our events and we ask them to invite their members, they will do that for us. And so investing in your community is one way of having the community also having interest in what you're doing. It's more than what you can do as one person, but that's why we teamwork, you know, community services, health ministry, and all other ministries in the church.
Amen. All right, guys. I'd like to thank the panel very, very much. Oh, we have one more. Okay, well, we'll do one more here. That's all right.
Thank you. My name is Treveline. I'm from Central Seventh-day Adventist. This question about going out to the community, taking the expo to the community, how about liability? Have you thought about that?
Liability, yes. So we have been fortunate because the Columbus Public Health Department has been the one that's helping us coordinate together with the Community Health Advisory Councils. So each side of town, if I could put it that way. So North Side has a health advisory council, West Side has one. And so we use those community leaders to then, invite us. Now, once it comes to the actual expo and the things that we do there, we make sure that we have a disclaimer. and there's a medical disclaimer that they need to sign, especially for the Harvard STEP test. So if you have certain conditions, you are engaging in this activity knowing that there are certain things that can happen. So they have to read through that and sign it, and that absolves us of liability. But there are other things that you just need to look out for that could lead to some liability. Like an example is just standing next to someone who is doing the Harvard STEP test, so that if they do fall, you can catch them. So very simple things, very small things. With the Children's Health Expo, again, we have people who are constantly watching, because it's just really important that you don't get into that area of liability. But the disclaimers, if it's more legal, I think you need to use disclaimers.
Another thing about the liability, before you schedule the event, please call your treasurer or secretary of your conference. I know that you're in Allegheny. Call them and tell them on this and this date we have this outreach event. So what basically they're going to do, they're going to contact the insurance agency that covers the Allegheny West Conference, and they will know about that. And this way, even if something happens, let's say someone falls and breaks a leg, the insurance company will not have any problem, and it will be covered through the conference.
I think at the New Start, it's a good example, because there is official paperwork that you can use for the New Start programs that you can have people sign. And I have examples of that here in the closet. I could show you what those disclaimers look like, and what the forms that we use are that people sign. To some respect, at health community events, there is some liability assumed when someone comes to you and says, please check my blood pressure, please put me in line for this. They're not giving you money for the service, so you're not accepting money in exchange for a service that you're guaranteeing that service. You're simply providing a service to the community for free. And that in and of itself lowers your liability in a conceptual sense, but in another sense, we do have them sign forms as they come through, and they sign into the health fair itself, actually, as they come through. And I can show you what those forms look like if you're curious. It's going to be time for lunch here in just a minute, so amen for that. Let's take about 2 minutes here. We'll get the stage cleared. I'm going to thank the panel. Thank you, guys. I'll give you a paycheck for the same amount that I got for today, for each of you. Don't spend it all in one place. And then we will have a quick prayer to close our service, and pray for lunch. And then we'll go to lunch. So give us about 2 or 3 minutes here. We'll get things picked up, and then we'll go ahead and close today's conference.
All right, I'm going to go check on lunch.
Do we turn this back on, Ben? Turn my mic back on. Check, check. Well, guys, I hope that today you will walk away with some high-level view of health ministry, some low-level, like nuts and bolts, how some of these things work and how you can use them. And thirdly, resources around the conference that you can have to help you be successful. Don't be afraid to fail. Don't be afraid to dream big. But start where you're at and build. My information is on the conference website and will be going forward. The email you used today to register, same email that you can contact me at for any questions you have. There will be some presence on the conference, the Ohio Conference website, of health ministry going forward. The next thing you'll see pop up will be the information for the 2014 Tin TV Health and Fitness Expo in downtown Columbus. We'll invite all of you and all of your parishioners to come get trained, and then to come help us do this health fair. And you can kind of see how it works and pull maybe some things back to your local community and do some health fairs there. Like I told you earlier, I have a big dream for Ohio. I want Ohio to become the leader in health ministry, not the follower. Right now, there are other conferences around Ohio that are doing really, really well. And we are kind of following in their example. I want Ohio to take the step to be the leader. It's going to take us, it's going to take you, it's going to take us working at the local level to build strong, parish-based programs in health. It's going to take us on a conference level to say, what can we do to really impact the health of Ohio? And it's going to take us working collaboratively to try to build the state up and become leaders rather than followers. I think that we can do it. I really do. Even without a budget, I think that we can do it because it's what the Lord wants us to do. He wants people to live healthy lives. He's just waiting for us to step up and say, let's do it. We pulled off this conference today without a budget. There's no budget for today. We didn't charge you anything to come. There are people that care enough about our ministry, health ministry, to want to help sustain it and push it forward. We're lucky to have a small budget at our church for health ministry, and some of what we're doing today is going to be paid for by that, and then the conference is going to help hopefully reimburse some of that money. That's our intent. That's our understanding with the conference, but you guys know how that goes. If you today would like to give anything to help offset the cost of the conference at all, there will be someone in the back with a basket, a tithe basket, or an offering plate. If you'd like to donate whatever you'd like to help defer the cost, that's great, but you don't have to. This is being offered to you at no cost because we want to start facilitating these kinds of conversations. If you would like to donate, though, we would be happy to use that money to help defer the costs of today. I hope that you will now know that you can call upon the people you've met today and use them as resources going forward. If you have any other questions, guys, I will be at lunch. I'm very excited about lunch. The chef who caters this event is very, very good. So I'm very excited about that. I'm going to go ahead and close with prayer. We've got about 10 minutes, and then lunch will be served in the fellowship hall. So I hope to see you all there. Please bow your heads with me. Father in heaven, thank you for being with us today. Thank you for blessing our event. Thank you for the travel mercies that have guided all of us here safely today. I pray that those that are here, those that are watching at home, those that will be looking at this conference and reviewing it in the months ahead that couldn't be here today, that you would use our time, our efforts, and our abilities and multiply them and bring them together and really carry forward the work that you would have us do. I pray that we would learn from your example to treat people with love first and to help them take a step toward having a healthier life. Thank you for all the things that you have shown us. Thank you for the way you've led us in the past. Please help us to realize that you only want plans that will help us succeed and to benefit us, and that if we work with you hand in hand, we can do amazing things. Amen. Thank you, guys. I think that next will be lunch in about 10 minutes, so take a chance, go outside, stretch your legs, meet us down in the fellowship hall, and we will have a wonderful lunch.
Guys, you really don't get a feel of what it's like and to give you a real perspective of what you can do in your churches. Just come to the training on all this thing. There are a couple of people from your church who are willing to help or willing to be trained. People who are going to be your left and right community supporting you in this ministry. Let them see what it looks like and you'll get some vital ideas. God's Spirit is just coming to them. When you see it, get them.